Hi, this is Don Carter with InternetOfTheMind.com. In this video, I'd like to talk about the stages of addiction and recovery. It's important for you to watch the video called the Iceberg Model because this will use that model to describe some of these stages. If you haven't already seen the video, you may want to double back and review that one on my website, InternetOfTheMind.com, or on my YouTube channel. We'll start with this diagram of the iceberg. This is a representation of the addiction cycle. The tip of the iceberg represents a few of the kinds of addictions that we can see in clinical practice and in the world. There are food addictions, alcohol addictions, drugs, sex, gambling, work addictions, addictions to drama, chaos, addictions to people. There are all kinds of addictions, and in fact there are over 200 12-step recovery programs for various kinds of addictions at last count. But these addictions have to do with seeking comfort and relief for the pain described in the iceberg model, abandonment, shame, and contempt. Whether that pain originated in childhood or through the progression of the disease of alcoholism or drug addiction or some other addictive process, the addiction itself was meant to be a solution to that pain. And because there was a love and trust relationship with an object or an event, that addiction ended up turning on the addict to the point that it increased the abandonment, shame, and contempt. Because through addiction we abandon our self-esteem, our relationships, our money, our goals, our dreams. We end up with more and more shame related to the failures associated with the addiction, the broken promises, the broken relationships, the broken job opportunities, and then we fill up with either contempt for ourselves for making all these mistakes or contempt for all the people trying to change our addictive behavior. And because the pain in the iceberg grows, that increases the need for comfort and relief, which then increases the pain, and you can see the cycle. Sooner or later, the addiction gets out of control to the point where hopefully the pain increases to the extent that we hit bottom. And you're bound to crash going 90 miles an hour down a dead-end street. And that's not always such a bad thing, because hitting bottom brings the opportunity of recovery. It takes quite a bit of pain for an addictive process to be broken enough for the addict to be able to take a good, honest look at what's been happening. And that pain can be our friend in that case. It can lead us into an opportunity for recovery. And if we should choose that opportunity, then we need to learn about these stages of addiction and recovery. And this diagram outlines the stages of both. The red line in the downward direction represents the process of addiction. The green line represents the process of recovery. The green dotted line is the transition out of addiction and into recovery. And you can see with addiction there's an early, crucial, and chronic stage. The early stage are when telltale signs of addiction will show up. The crucial stage is where we need to arrest the disease of addiction in that stage so that we don't move on to the more chronic stage. If we get into the chronic stage of addiction, the chances of recovery are reduced and the complexity involved in treatment is increased because there's a lot of physical, emotional, mental, and spiritual damage by that time. And we'll go into those stages here in a moment. Transition and stabilization lead us into the recovery process, which also has an early, middle, and late stage, and we'll cover those as well. The early stage of addiction has some pretty important telltale signs. Now, there's been over 90 symptoms and signs of addiction. We're not going to cover all of them, but we'll cover the hallmark signs of each stage. And this is the early phase, or the early stage of addiction. The signs include relief using of the addictive process, whether it be drinking or sexing or gambling or working too much. then there's an increase for the addictive behavior or the addictive substance. And there's a preoccupation that starts out kind of small and then continues to grow over time. The preoccupation may be as simple as just reminding myself occasionally that 5:30 is coming up. I'll be off work and able to engage in the addictive behavior. Later in the late stages of addiction, preoccupation turns to obsession. For addiction to flourish and grow, there also needs to be a system of denial, which creates a world of delusion that the addict and even family members can get caught up in. And denial can get pretty strong, and the delusion can take over, and there is no getting through to an active alcoholic or addict of sorts because they can't see the truth of their addictive behavior. Loss of control, again, can start out very simple. Simply deciding I'm going to have one beer after work turns into 3 or 4 beers and I'm late for supper. Then that's a loss of control. A minor one at first, but they continue to increase in frequency and in duration and in amount. And so this loss of control grows over time to what we see in the later stages, especially the chronic stage, as maintenance drinking, having to get up at 2 in the morning to have a drink so I can sleep at night, or engaging in the behavior at all hours of the day. Continued use despite negative consequences. DWIs, broken relationships, broken promises, money troubles, anything that has a strong negative consequence that's explained away, justified, rationalized, or otherwise accepted is the addict becoming willing to pay a heavy price to continue the addictive behavior. And so continued use despite negative consequences is a major hallmark of addiction. Sneaking, hiding, stashing the addictive activity or object is also a telltale sign. In the middle stages, we start to see some pretty pervasive damage to the most important areas of our life. In clinical terms, our psychosocial functioning becomes impaired. We begin to have family problems. Maybe at first they're minor family squabbles, but after the middle and late stage, then these squabbles can be something along the lines of being in our 3rd marriage or losing our 4th marriage. Social problems can occur. Friends that get offended when the addict makes a pass at his wife, or the boss who gets upset when the employee makes a show or causes a scene at an employee function. Financial problems related to legal situations or spending too much money or blowing the payroll check before making it home. Emotional problems, depression, anxiety, anger, all those kind of things can flare up. Of course, the legal troubles involved with domestic disputes and driving while intoxicated, or fights at the bar or the gambling casino, or being arrested for soliciting a prostitute if it's a sex addiction. Occupational problems, of course, those are always the last ones to show up, because if I don't have my job, I can't afford to continue my habit. So hiding it at work becomes paramount for a lot of different reasons. But you know that we're in the middle phase when psychosocial functioning becomes impaired. They call this the crucial phase because passing over into the chronic phase makes things much more difficult. The chronic phase, or the late stage of addiction, begins when we start to see the physical problems that come along with it. Stomach problems or respiratory problems or heart trouble from high blood pressure, stress-related problems, migraine headaches, withdrawal syndrome. When the activity or the object is not being engaged with, then there's a period of withdrawal with increased anxiety and restlessness and paranoia and cravings and so forth. Then there's a collapse of the alibi system. Things are so bad in the late stage that there's no excusing it away, justifying it, or rationalizing it. And then there's drinking or using the addictive process just to feel normal, just to be able to function. Obsession replaces preoccupation. Now it's a 24/7 kind of a proposition. Where, when, and how am I going to engage in the behavior again? And by this time I have a loss of supports. Family members give up, employers give up. Um, Losing 3 or 4 jobs makes it really difficult to be hired, along with the physical problems associated with the late stage. Hopelessness and despair can settle in at this stage. And there's a kind of a two-edged sword because the physical problems are combined with the emotional problems associated with trying to stop using. The depression and anxiety can be so bad that the addicted person may want very badly to stop, and when they try 2 to 3 days into it, the pain from the withdrawal kicks in, and they may relapse or return to using in order to make that pain go away. So I put this in here, dual progressions, to highlight one fact, and that is that codependency is also an addiction, and addicts of all different sorts tend to find themselves attached to codependents. And codependents have an addiction to the outside. They need an external focus. And what better external focus than a problem person? Someone to fix or rescue or bail out or try to control or argue with. And this is not a premeditated decision, but it's one that the codependent finds themselves falling into, subconsciously programmed with a love map that's compatible with an addict. And since codependency is an addiction, it's a parallel disease process. The codependent has relief using and drinking. Maybe they're eating for relief, or using medications for relief, or even drinking a little bit for relief. There's an increase in tolerance for the addictive behavior of the problem person. There's a preoccupation. What's that problem person doing now? It's lunchtime. I wonder where they're at. There's denial and delusion. This is just a phase. If I just help him along, he'll be okay. There's a loss of control over eating or over yelling at the kids or losing our temper, and emotional loss of control. There's continued use of enabling behaviors despite the serious negative consequences, DWIs and bailing them out of jail and calling into the employer and making up stories about why they're late or not there again. There's sneaking and hiding and stashing of relief objects and so forth. With codependency, there's also the family problems, the social problems being that the codependent has to screen all the calls to decide which invitations to accept, just to make sure that we don't choose to go somewhere where the addictive behavior is tolerated. And so friends can get snubbed and feel bad, or other social problems, embarrassments at the local restaurant during family night, and those kinds of things. Financial problems, of course, emotional problems, depressions, anxiety, legal problems, domestic disputes and ex partes and restraining orders. And then, of course, there can be occupational problems with codependency as well, because the codependent, being obsessed and caught up with the addiction of the problem person, can arrive late to work or leave for lunch early, or not be able to perform up to par due to exhaustion or depression or preoccupation. And the codependent can also enter into a late or chronic phase. They begin to have physical problems, high blood pressure, ulcers, migraine headaches, fibromyalgia, chronic fatigue, you name it, all kinds of stress-related disorders. There's a withdrawal syndrome with codependency. They may set a boundary and they may kick the problem person out, but 2 to 3 days later be suffering from aloneness too much and allow that person to come back just to make the withdrawal symptoms go away, the anxiety and the ache on the inside. There's a collapse of the alibi system. They can't make excuses. They can't cover it up. They can't hide it anymore. Not even their own codependency, because it's just too obvious. They may drink or use over-the-counter medications or eat or do some other substance abusing behavior just in order to feel normal. Not to feel good, but just in order to not feel bad and in order to be able to function. And then the obsession of codependency replaces the preoccupation as well. Families can give up on codependence. They've tried to get through and tried to get through and tried to get through, and finally they just cut them off. Employers can give up and let the codependent person go, especially as the addiction worsens, leading to more hopelessness and despair. So it's a completely parallel process that the codependent gets just as sick or sicker as the addictive person in this family illness of addiction. Okay, so let's spend a little time now talking about the stages of recovery. And in this case, with Prochaska, Norcross, and DiClemente from 1994, who came up with a model on motivational interviewing for counseling addiction, people affected with addiction and their family members, they identified these 5 stages of change. And the first stage is actually pre-contemplation. This is before the question is the drinking or sexing or gambling or problem, before anything even becomes a question. That's pre-contemplation. There's no contemplating it even. But as soon as something happens and the question comes up, maybe this person has an addiction problem, then the contemplation can begin. And let's say it's an alcoholic person and they're just fresh off of their first DWI, and someone's been telling them they've been drinking too much. They start to finally question that themselves, and as they do internally, each of us have our own lawyer, a defense attorney, and a prosecutor. And the prosecutor, the internal prosecutor, is presenting a zealous case about why I should really take a look at my drinking, while the defense attorney inside is presenting a zealous case about why my drinking's not a problem. And the battle goes on until the internal judge makes a decision, and that's at the green arrow where it moves us into preparation. When the judge makes a decision, it has 3 components. The judge decides what the name of the problem is, how bad it is, and the plan, what to do about it. And then, having a plan, we move into action, putting that plan into action. If the action plan works, then we have reached the maintenance phase, which helps us exit the recovery wheel, otherwise known as the merry-go-round of denial. And if the maintenance plan, the action plan does not maintain, then we end up in relapse. And relapse will send us right back to the contemplation stage. And we may go around this merry-go-round 200 or 300 times. And to give you an example of a common trip around the merry-go-round, let's say the alcoholic, the internal judge decides, okay, yes, there's a problem. The name of it is, my wife thinks I drink too much. How bad is it? Pretty bad. She's going to leave me. What do I need to do about it? What's my plan? I need to go underground with my drinking, maybe just sneak a few drinks out in the garage while I'm working on things. And if that plan works, then I'm in maintenance and can get off the wheel. If I somehow, sooner or later, get busted again, get caught drinking, or have another problem related to it, the relapse is in place, and then I'm back in contemplation. And then maybe later on, the judge decides, yes, I have a problem, it's alcoholism. How bad is it? Pretty bad. I've lost 2 wives already. What do I need to do about it? I need to reach out for help. So my action plan is to go into treatment. If that works, I maintain and exit the wheel with a good solid recovery program in place after treatment. And if I continue following that recovery plan and doing all the things necessary, I have a good chance of staying off the wheel. But if my plan is not effective enough and I don't follow through with my plan, then I relapse and I'm right back at contemplation. This time, what do I do about not staying in recovery? What's the problem here? And the problem may be that, okay, I stayed away from drinking and I've abstained, but I haven't gone to any meetings, or I haven't gone to enough meetings, or I haven't done the counseling, or I haven't done the follow-up and the aftercare. So all those kinds of things can happen even in recovery. And these stages of change fit really well with addictions, but they fit with any kind of problematic behavior. So there's something to keep in mind there. And again, taking a look at the stages of addiction and recovery, we're going to look down here at the transition and stabilization phase, where we're transitioning out of addiction and into recovery. This is where we have treatment. This is where we make that leap between one world and another. And in the transition phase, there's usually a crisis, a motivating crisis period that comes up that causes us to hit bottom and crash. And at that point, the task of transition is to recognize that we have a loss of control, and it's to accept the need for help, and then to reach out to others. Some of the most difficult things for an alcoholic or addict of any kind to do when they have a problem. But if they do it and they enter into a recovery process and they get the appropriate kind of help, then within 30 to 90 days they can reach stabilization. Stabilization is where we've achieved abstinence, which means we're not engaging in the addictive behavior. We've recovered from the physical withdrawal to the point that it's no longer an issue. There is a protracted or extended withdrawal called post-acute withdrawal. That's something on a subject for another video. We interrupt the preoccupation and obsession with the addictive behavior and replace it with learning a new recovery behavior and a new way of life. We develop hope and motivation because it's working for us, and we see it working for other people because we're around other recovering people who've been through this before. And then we begin the development of our own recovery program, because everyone's different and we need to create a unique recovery program with some common elements. And this is how the transition and stabilization phase will look on the iceberg. If you see at the top of the iceberg, right up here at the tip, we've given up the addictive behavior and replaced it with treatment and counseling. And that's bringing us some comfort and relief. And we're still externally focused on learning treatment and counseling techniques and community support groups and various 12-step groups, and learning the lifestyle of recovery, so that still keeps us externally focused, and we still have all this dysfunction and all this accumulated pain to deal with on the inside yet. But we have given up that addictive process for the time being, at least. And if we do nothing else, we're doomed to go back to the addictive behavior. The tip of the iceberg is needing to be dealt with first, but everything else must be dealt with at some point, and in the recovery process it shall. In the early phase of recovery, that would be somewhere around 6 months to a year, the tasks are to deal with the drinking problem and the thinking problem, the physical healing, getting over the withdrawal syndrome, healing up the physical damage associated with the drinking or the drugging or the gambling and the stress and different kinds of physical problems that come up with addiction, giving our body time to heal, giving it the right kind of diet, sleep, and exercise. And we are also dealing with the psychological healing, that thinking problem. We created a world of denial and delusion, and it's woven into the fabric of our thought, and to unweave that system of denial from our thinking takes a lot of rigorous honesty, openness, and willingness, and it takes a while to straighten that thinking out. And initially, if we're in a 12-step program, then we're working on steps 1, 2, and 3 in this phase. Now, in early recovery, after we've stabilized and gone through transition, you'll notice at the tip of the iceberg now we've internalized a recovery program, not just a connection with other recovering people. Now we're actually engaged in working a recovery program and starting to receive some of the benefits of that. We've gotten honest, open, and willing. We've started giving up control. We've even begun turning our focus inward as we've begun step work. We've connected to a power greater than ourselves for comfort and relief. So we've gotten a couple of very important elements in place here that begin to help internal functioning improve. And yet we see that the roots of the problem still remain to be dealt with, and that's the development of the false sense of self, the contempt, shame, and abandonment that covers up that true self, who we really are. So the wreckage of the past still needs to be cleared away, and in early recovery, we move to middle recovery. 2 to 3 years into recovery, we're beginning to get very serious about emotional healing and interpersonal healing. Our feelings and our relationships are improving. We have graduated and moved out of the need to be so vigilant about our physical and thinking problem that we can start to focus on more advanced issues. That doesn't mean we let up on what we've accomplished in the early phase. It just means that we begin to change our focus to go a little deeper and deal with these feelings and intimate relationships. And we work on steps 4, 5, 6, 7, 8, and 9 in this 2 to 3 year period. Generally speaking, everyone has their own pace, but typically this is where we get into real good house cleaning, and that's what steps 4 through 9 do. Is where we first go in and start really cleaning out a lot of the abandonment, shame, and contempt. And here's how it looks on the iceberg. The recovery program is still internalized. We got more honest and open and willing. The step work is internalized as well. It's becoming part of us. And we've engaged in the 7 S's outlined by John Bradshaw. Those 7 S's are the most important things for healing the internal wounds of abandonment, shame, and contempt. The first one is socialization. That means come out of hiding, join a 12-step group, join a church group, join a therapy group, go somewhere where you can come out of hiding. And then you can do number 2, self-disclose. Begin to share who you really are, who you think you are, who you're learning about you are. And that's self-disclosure. And then becoming more and more sensitive to the system, family system that we came from, and how that affected us, and how the problems in our family were passed on from one generation to the next, and how we can stop that ball from rolling downhill. But then we have to change that self-talk. We have to listen to the inner critic and take out the shame from that inner criticism and just keep the part of the criticism that's meant to be analytical and helpful. We do need to have a part of us that can be helpfully critical, but not hurtfully critical. And then there's self-love, which is more than just wrapping ourselves in a blanket and saying nice things in the mirror. Self-love is doing the work of recovery. It's getting to bed on time. It's getting up on time. It's discipline. It's giving ourselves time, attention, and affection. And it's taking care of ourselves. Surfacing the pain, which is what we're doing with the step work, is digging up and cleaning house. And then spirituality, which is the big S. It's the one that is responsible for the primary healing. And as you see, this false self begins to shrink up and to heal, as any other wound can heal, because it's getting the medication or the treatment. Then it begins to heal. We've initiated the healing process, and as a result, the true self begins to emerge, and we begin to learn things about ourselves we never knew through this recovery process. And we learn our purpose, our meaning in life, which sets us up for the late stage of recovery, 3 years and up. The tasks in the late stage are spiritual healing. That's healing that relationship with God as we understand God and living according to the way we feel He would lead us to live, which helps us find out more and connect more with our true self, which is self-actualization. It's becoming everything that we were meant to be, everything that we can be, and now our life is back on track and we're in growth mode, and we no longer have to worry about stress and survival mode. We do need to be able to manage stress, but stress doesn't manage us because we're in control of our recovery. And so we maintain a healthy recovery program, and we continue to grow. And we do this for the rest of our life, and things just keep getting better and better. And these steps 10, 11, and 12, the maintenance steps, are the ones that are the focus in that stage. And here's what the late stage of recovery looks like. The internalized recovery program remains, the honesty, openness, and willingness directed inward. We don't have a need for comfort and relief from the outside. We don't have a need to wear a mask or control other people's impressions of us. We don't have anything to cover up anymore because we've connected with our true self, and that radiates outward and connects with our higher power, and we find life as it's meant to be, enriching, rewarding, with purpose, productivity, and meaning. And so the moral of the story is that when we're living the way we were intended to live, that's when things get better. And so happiness is a byproduct of living that way. It's not something we can look to something outside of ourselves, like an addictive process, to find happiness, or material things to find happiness. We find happiness within. Happiness is an inside job that comes with self-actualization. And that is the conclusion of this video, Stages of Addiction and Recovery. We'll have many more to come. Thank you for watching, and check us out on internetofthemind.com. Let us know if you have any recommendations or requests. Thank you again for watching.